Okay. I'm Dr. Zuhairi. I'm now working as a medical officer in Hospital UiTM. But for some reason, I've also been developing software for the past, I think, 4 years now. And it's a long story though. I actually initially want to become an engineer. But when I applied, I got a medical offer instead. So my father said, go for medicine. That's what we do. So let's obey your dad. And then now I still see patients. I focus more on developing software applications, and even now I build AI systems to help patients in the clinical settings mainly. So I work with many stakeholders from the government, from the private sector, some clients. Basically, try to work with them and how we can help. Sometimes I work alone, sometimes I work in a team. So hopefully I can share some insights with you today.
All right, thank you. Dr. Hanis?
Hi, good morning everyone, or afternoon. So I'm Hanis. I'm currently working in the Ministry of Health, in the headquarters for the Hospital Information System and Hospital Digitalization Unit. So my main work is digitalizing the hospital for the entire public hospitals. So a little bit about my background. I was a clinician, particularly in pediatric, for about 6 years, and then I ventured into this technology. I think it's since the pandemic, because we have some pain points at the ground level during COVID, and it kicks me to learn more about technology. And then when I applied for Master in Health Informatics and Analytics, I get this opportunity to join the headquarters in the HIS unit. So I just joined them actually a year ago, and I just completed my Master last June. Yeah, I think that's about it.
All right, thanks. Kev?
Yeah, so I'm the CEO and co-founder of QMed Asia. So before this, I was the medical doctor serving KKM for 7 years. Pretty much interested in clinical works. If I was given the opportunity to join this event back then, I would choose another hall, not this hall. So I served Hospital Selayang, Bintulu, Sungai Buloh, all in my pediatric department. Gotten my master. I'm very interested in pediatric intensivists. So that's my dream back then. So why today I'm sitting here is because I have a daughter that has some medical condition back then, around 6 years ago, that pushed me to think of something else to do. My wife is a pediatrician, so if both of us in clinical, you understand how crazy is the schedule to be. So I actually came out 6 years ago to bring my daughter for follow-up. Along the way, we go to HKR for genetic clinic, Selayang, Sungai Buloh, get frustrated with the waiting time. And that's the time that actually pushed me to think of something we can do for this healthcare industry other than what we have learned in med school, which is providing the best management, all these things. So fast forward today, we started the company 5 years ago, providing queue management, appointment system. If you heard about QMed, mostly you heard about we providing appointment system for clinical kesihatan, queue for clinic, hospital. Then that's how we scale up until today. So today we provide quite a wide range of solutions. We are B2B. B2B is a business model. Basically, it's like we're providing solutions for clinics, hospital to use, not really facing patients. So we actually provide quite different things there. Patient journey, self-referral kiosks to improve the patient journey experience. We have the Connect solutions where we do integration with the medical device in the hospital. And last but not least, we venture into medical AI solutions. It's quite a new things in Malaysia, in even the whole world, Dr. Zhu understand. So we want to be to see what we can bring AI into healthcare, what the value can bring to the patients.
All right, thank you very much. Do you know what is common with the three of them? They are taking care of computers. They are not taking care of patients anymore. Jokes aside, all right? So, okay, now I'm going to see how I'm going to make this discussion more interesting. So, those of you who have questions, so I think this is a good platform to ask questions that has anything to do at all with how can you actually get into what they are currently pursuing right now. So if you have any questions, please feel free to drop it down. I'll try my best to answer as many as possible. All right? Okay, I'm going to go ahead with my very difficult question. All right. Okay, so first question. I think let's get to the basics first. Technology has become an integral part of modern healthcare. Okay, so whether you like it or not, from wearables to medical devices to even applications in the cloud, even applications that you don't even see it, it's monitoring patients' vital signs and things like that and whatnot, right? So I think the question is, for everyone that is actually sitting here today, what are the skills or competencies that they need to acquire to actually get into whatever that you guys are doing? I'll start with you first, Zu.
Thanks for that. Maybe we all have different ideas on how we can tackle technology, right? So if you were to go very basic, right, you don't have to know any coding at all, to be honest. Nowadays, we have many platforms or framework that you can use that doesn't even involve coding. Just for example, Excel, right? Simple Excel. If you are very good at Excel, you can do a very bunch of things with data with Excel. No coding at all, right? For example. But my part is a bit different, okay? Because I'm very keen to computers when I was very young. So I started to learn to code about 10 years ago. I was coding and coding away just for fun. And it was like 5 years ago that I really seriously go into building apps. I was a medical officer at Tawau, Sabah at the time. I was working in psychiatry even until now. So in psychiatry, we have this service called community psychiatry unit, right? You went and find patients, schizophrenics or bipolar in their homes and houses. So in Sabah, they don't have any proper addresses. For example, if I say, find this patient, where is it? You can find yourself under the bridge or whatever location. So we have trouble detecting these people, right? So understanding the difficulties of my staff at the time. So we decided, let's build an app. Just use a simple Google Map API. We plot their location, use this app to track the patients. It worked wonderful. So we won some awards for that, innovation, whatever, bunch of stuff. So just understanding the things that you have to do is the thing that you have to do. Sometimes you don't have to code. Okay, back to the question. So do you have to learn how to code? If you can, yes, you should learn how to code. Because why? Most platforms or machines, if you go very deep, right, they go into binaries, right? 0, 1, 0, 1, 0, 1. Just above it is a machine level coding. It's very difficult to read. But above, you get all these software developers like Python, JavaScript, and all these languages. Above these languages, you get all these simple click and drop thing. So up to your preference. If you want to go very deep into the development, you go into coding. If not, if you were sort of people who wants to manage stuff and become a manager, you can get away with not even learn how to code. But like I think many speakers mentioned before, you have to start somewhere. It's not about completing your bootcamp or completing any courses. Just start straight away, troubleshoot the way through, and just be persistent and persevere. You will get there. That's my take on that.
Thank you. So, Dr. Hanis, what do you think? What are the skills that is required to get where you are, what you're doing right now?
Okay, for the skill set to get where I am at now, so actually technology is a very wide horizon. Okay, technology is not just about the data; it's about the infrastructure. It's about the electric support that can support the system to be installed in the facility. It's about the core team to deploy the system. It's about the machines. It's about the data center, and there's a lot of skill set that you can get. But for us that have a medical background, the most important skill set that you have is your unfair advantage of your experience in clinical. So how can you leverage those clinical experience to get into technology? It's about learning the work process in the hospital or in the